A federal judge has rejected Medicaid work requirements in the Granite State. This is a new decision coming out of the state of New Hampshire, a state that had planned to implement very restrictive work requirements in its Medicaid program. The federal judge is a judge we've seen before. This is federal Judge Boasberg. He's the same guy that heard the lawsuits of both Kentucky and Arkansas, the work requirements in their Medicaid programs. And he struck both of those down because of the terrible consequence to people being kicked off of their Medicaid. Now, he wrote in his opinion that we've seen this movie before because he was very critical of the fact that the Centers for Medicare and Medicaid Services just copied and pasted their approval of the waiver, the New Hampshire waiver approval that would make work requirements happen. He said this was just copy and pasted out of the Kentucky letter that that CMS drafted, and they didn't come up with any new justification of how this demonstration project would actually improve the health of the people of New Hampshire. So what's going on in New Hampshire? Well, the work requirements for New Hampshire were approved by CMS in that letter that looked a lot like Kentucky's letter. It was called the Granite Advantage Community Engagement Program, which would mandate 100 hours of work or volunteering a month for individuals to keep coverage. That's more aggressive than what we actually saw in Arkansas and Kentucky and some of the other states that had work requirements approved that had a threshold of 80 hours of work per month. The requirement was part of the New Hampshire Medicaid expansion program. The waiver also eliminated other things like backdating. It had other harmful elements to it, but at issue in this lawsuit was the work requirement. So the implementation initially pushed back. It was supposed to go into effect much earlier this summer. It was delayed when it became clear that about 17,000 people in New Hampshire would be losing their Medicaid, which doesn't sound like that many when you can compare it against Arkansas, but that's 70% of the Medicaid population in the state. There's just a lower population density in New Hampshire. 70% of the Medicaid recipients, non-exempt, which means the work requirement would have applied to them, would have lost coverage. So 4 residents stepped forward, they sued, and the judge ruled. In his opinion, he said the U.S. Department of Health and Human Services, CMS, in this case, failed to take into account how many people subject to the work requirements would actually lose Medicaid coverage. He said you can't have a Medicaid program with its goal of improving the health of the people of the state when you actually lose 70% of the people that should be entitled to that program. He said CMS actually failed to consider the effect on low-income individuals who rely on Medicaid. He said this is an administrative law requirement. He actually didn't even evaluate the rule on its merits. He stuck to this provision that said this is an administrative law requirement and you failed it, HHS. You have failed it 4 times. The judge called the CMS approval arbitrary and capricious. That's a standard of evaluating the rule, and it said that this is actually more damaging than what he read in both the Kentucky and Arkansas letters. Now, the letter from CMS to New Hampshire, like I said before, he said this was just a carbon copy. You didn't even evaluate the state's dynamics, the uniquenesses of the people of New Hampshire, and he said this is just not acceptable, which is good news for the people of New Hampshire. Now, still at issue here are the people in Arkansas and the people of Kentucky. Now, Judge Boasberg struck down the implementation of those rules. In both instances, the Department of Health and Human Services says they will appeal. The impact in Arkansas was 18,000 adults. The impact in Kentucky, 95,000 could be subject to the work requirement and could lose coverage. So the impact here is huge. This is good news out of New Hampshire. You can read the decision yourself. We link to it in the description below. We also remind you of the other 2 cases coming out of Kentucky and Arkansas. You can see how they are similarly situated. If you have questions on work requirements in Medicaid, you can send us a note and you can find us at healthwatchwisconsin.org.